I had a high temperature at home. I was having difficulty breathing as well. My wife and I went to patient first to see what was going on, and we both took the test for COVID, and we both tested positive. But my wife never showed any symptoms for COVID at all. I mean, I went to the intensive care unit right away. Then certainly what kicks in is the nursing, just the whole care that I received, everything from housekeeping to nursing, but primarily the nursing care on a regular basis. I never had the impression they were frightened when they were with me. Even from the nursing assistant putting eye drops in my eyes to anybody else touching me or helping me get in the prone position when I needed to be, I wasn't being very good about it. It's not a comfortable way to be in bed. Just kind of looking me in the eye, I mean really close, looking me in the eye and saying, "You're going to be okay." I mean, I could tell he really, he knew somehow that I was going to be okay. And that was really a biggie. The nursing group, in addition to being so competent, primarily their kindness, I'll always remember, and their intelligence. They knew what they were doing, and I feel like being a part of their celebration is such a minimal way to say thank you for what they did for me.
Welcome to the 2022 Art of Nursing Awards. Put your hands together for your president and CEO, Dr. John Chassar.
I'm not sure that there's anything that I could say or any of us could say that could beat that video. Isn't that? It's just phenomenal. Well, good afternoon, everyone, and welcome to the 7th Annual Art of Nursing Awards celebration. Thank you to all of our leaders in nursing, human resources, marketing, and philanthropy who planned this event. And I especially want to extend my deepest gratitude to our outstanding nursing staff throughout our 3 work systems, our hospital, GBMC Health Partners practices, and with Gilchrist. Some of you have been at the bedside, as we just heard, caring for the sickest patients during the pandemic. Others have been doing the consistent and meaningful work of managing and coordinating care to help people stay in control of their health. But no matter what your individual role was, colleague nurses, each of you is part of an incredibly powerful part of a true system of care. Thank you so much for staying with the GBMC family. Your dedication to our vision unites us and gives me tremendous confidence for the future. As you know, there wasn't any rule book for much of what we faced and for much of what we will continue to face, but your commitment to treating every patient every time like your own loved one means we are always headed in the right direction. And I am proud and grateful to serve this community with you. Thank you so very much. And now, please join me in welcoming to the stage the chair of the GBMC HealthCare System Board of Directors, Mr. Fred Hudson.
Thank you, Dr. Chassar. And thank you, Dr. Iano, for inviting me to GBMC's 2022 Art of Nursing celebration. I am sincerely honored to be here this afternoon to address our nursing staff. It is the heart and soul of our great institution. Everyone knows the caring and humanity inherent in the nursing profession, and we know how fortunate we are to have the best nursing professionals here at GBMC. Even without the immense challenges of the past 2 years, your selfless dedication to GBMC's patients is seen and appreciated every day. The members of the Board of Directors thank you for your truly exceptional service. The great American author Maya Angelou said of nurses, and I quote, "We have the opportunity to heal the heart, mind, soul, and body of our patients, their families, and ourselves. They may forget your name, but they will never forget how you made them feel." She reflects on a nurse's unique ability to care for not only the physical needs of a patient, but the whole person, body, mind, and spirit. The GBMC HealthCare nursing staff has always made us proud, demonstrating strength, professionalism, dedication, and resilience. You are so appreciated by the patients and their families, by your colleagues, and by this community. One need only look at the messages of gratitude throughout the hospital to feel how grateful the community is for your hard work and sacrifices. So thank you for everything you do. Thank you for maintaining the quality and patient-centered care GBMC is known for. And thank you for providing health, healing, and hope to our community every single day. And congratulations to each and every one of you who are here today. Thank you.
All right, so COVID, what can I say about that?
What the heck? Honest opinion.
I was just nervous at first. I was like, oh, it's just the flu. We should all wash our hands. We'll be okay.
Oh, this is going to pass. Like, they think it's so serious.
But boy, was I wrong.
It just seemed like something from a movie that you would see on TV.
I was literally going home after my shift, and I get off at 11 p.m. I go home, and I was turning on the news right away.
I remember having to call an emergency staff meeting because our floor was going to be the designated COVID floor initially. I think the feeling at that time, it was just anxiety and fear.
Lots of questions and lots of preparation.
We were all on edge. Like, when would this start? Where would this first patient be? What would they look like? Who would take care of them?
How do I support a team when I don't know what I'm dealing with myself yet?
Scared, to say the least, not knowing if I would encounter the virus by, taking care of my patients, by drawing their blood or just entering their rooms.
We didn't know how many ventilators we would need, how much staff we would need, how much burden it would put on the hospital, on the nurses, on the whole staff of the hospital. It was scary just not knowing what to expect.
We would think about what PPE we had to wear, how much PPE we had to go through, how much PPE we still had left.
I never thought that I'd be in goggles, mask, gown, gloves, boots, hat, double mask, just to take a heart rate or just to, walk past somebody.
I was just always so hot. I'm like, I'm going to pass out in these patients' rooms and then there'll be 2 of us in there.
And then, of course, you get home and you're washing your clothes the second you walk in the house. You're, taking your shoes off. Can my dogs lick my shoes and get COVID? I don't know. Who knows? But, that was my life.
I would go into my Florida room, strip down, be naked, even in the winter months, and then go in and leave my clothes there for at least 2 days.
My friends quarantined me for 2 weeks because they were scared, and
trying to keep ourselves safe, keep our patients safe, and try and keep our family safe, and it was definitely difficult.
It got very, sorry.
Have you ever woken up for work and you're just like immediately filled with dread? Like, you're just like, what is this day gonna bring? It was when I first came down to pediatrics. I had only been on this unit for a week, so I was an inpatient, and now I'm in the ED, and then they're like, oh, the computers don't work. And I'm like, what? The computers don't work?
One of my friends texted me like, hey, our computers got hacked. And I was like, there's no way that's real life at all. She's like, well, it is. I'm like, okay. And every day since then I would think like, well, it can't be as bad as that. And then we'd have the next surge and you're like, well, it always can get worse than it was the day before.
I remember the first patient coming up, everything seemed to go relatively smooth, and then it was really just a snowball effect after that, it felt like.
Day in, day out, every single shift, 4 or 5 COVID patients walking in, you know, a few of them going to the ICU, a few of them going to med-surg.
Completely bombarded by patients like day after day, just coming in really sick.
The team having to bag multiple bodies every day. That had emotional impact.
Seeing patients before they were intubated, getting to know them, learning about them, learning their stories.
This is a person that, you know, had a whole life, whole friends, family, had their ups and downs, their problems, their little joys.
You just see them deteriorate. They can't breathe. They're tired. They're working so hard. And just them knowing that intubation's coming, the odds of me surviving this are very unlikely. Saying bye to their family, their friends, like you're the last person they see. So that's probably one of the hardest parts.
Having all that come to an end and being there at the end, it's just, I think it's a perspective, I don't know, it's pretty sad, so.
A lot of our patients could not have family members with them. It was the ICU nurses who are sometimes that one hand, holding that hand and comforting that patient. So it hit home. It was for sure exhausting.
A lot of nurses did get burnt out and they left or they went to travel to make more money, and which made us short. So we have to work even more so as a team as we ever had in the past.
I have my off days and it's like I have so much stuff to get done and I just don't want to move from the couch or my bed. Like I just want to fully relax.
I try to stay calm and positive, but I did find myself coming to work, parking, and kind of just sitting there for a little bit. And
it's not only emotional, but it's physical and mental.
There was moments where it became really hard and it was a struggle to kind of get up and go into work every day. Absolutely.
Unless you're here and you're going through it and you're seeing these people struggling just to be able to breathe or whatever it is, they can't relate at all. They really can't.
We've had a lot of turnover in nursing because of COVID, but I feel like those of us who've made it through the other side have formed a bond because of it. And, you know, it's almost like we've been through the battlefield, like the band of brothers.
I could not continue as a leader without the team that I have and being here to support them every single day. It's what's important to me.
Just having great people around me that truly do care about me here and outside of here. I literally, genuinely love the staff here.
My mom's the first ER staff here. So I've watched this place grow from a little building to this big, huge campus.
Man, I'll never forget our crew in the MICU. Like that bond will never go away.
I love my team so much.
I love the team here at GBMC. It's been such a positive experience.
Staff that made it through were stronger, and I feel like there is this sense of pride, and it's positive, which is nice, for sure.
I want to tell all of GBMC nurses, particularly my team, just how proud I am and happy I am to be a part of this organization, even with how difficult everything's been the last few years.
We stay resilient. We continue to communicate, and we continue to be the joyful and excellent team that I know these teams are. And I am grateful every single day for all that you do. So thank you.
From the bottom of my heart, it's an honor to work with such excellent team members. And I want to say thank you and Happy Nurses Week.
Wow, that's a emotional video to watch. The reality of what staff have gone through, not only as nurses, but I'm sure our physician colleagues and other clinicians. You know, when you go through something that daunting day in and day out, you don't realize how hard it is until you get to the other side. And what doesn't kill you absolutely will make you stronger. And everyone should be very proud of the care that we gave our community. And Mr. Howler, thank you for sharing your story when you are here with us today. So I do want to talk about, not to be so, start crying early on, but I am excited to tell you that this year, the first time we're going to have a People Choice Award, and it's actually the Nightingale Award. And for the first time ever, an award will be voted on live during today's celebration by all of you. So throughout the program, you will see 3 videos that are showcasing the top Nightingale finalists who were carefully chosen by the Art of Nursing Awards Committee out of 50 nominees. The Nightingale Award will be presented to a nursing staff member who inspires colleagues by demonstrating high standards, a team mindset, and a dedication to ensuring positive outcomes by going above and beyond. When you've seen all 3 videos and decided who you think best fits these criteria, you can use your phone to scan the QR code on the back of your program to vote. So thank you to everyone who nominated your colleagues. And now we'll turn our attention to the first award of the night, which is the Inpatient Clinical Assistant Award.
The Clinical Assistant Support Award is divided into 2 categories, inpatient and outpatient. The Inpatient Award is given to an individual who demonstrates outstanding care delivery in an inpatient setting. The finalists are
Aurora McGarry, Unit 46, and now NICU.
Just Fayol, Unit 35.
Josh Trellick, Radiology.
Presenting the award is Angie Fuhrer.
And the winner is Jessica Fayol, Unit 35. Is she here?
The second Clinical Assistant Support Award is given to an individual who exhibits excellence in care, including superior work ethic, dedication to a team approach, and exemplary interpersonal skills. The finalists are
Rhonda Williams, Pediatrics.
Bernadette Romanowski, GBMC Health Partners at Texas Station.
Kimberly Ross, Gilchrist Kids.
Presenting the award is last year's winner, Ronnie Good.
Thank you. And the winner is Bernadette Romanowski. Texas Station. Where is she?
Hello.
I nominated Zoe for the Nightingale because Zoe just has something about her that's phenomenal. She has je ne sais quoi.
I nominated Zoe Ogden for the Nightingale Award. Been a child life specialist for 6.5 years, but have only been here at GBMC since October. And in that short period of time already, I can see the love and compassion that Zoe exudes.
She has the ability to really connect with families in a way that makes them feel important and a part of the unit and a part of the care of their infant. She also has the ability of having a positive aspect on the unit and making everybody feel included, and that the day, no matter what it is that comes, is going to be great.
It doesn't matter if she is having a rough day or anything going on, she just puts the patient and the family first all the time.
Zoe's just, she has it. If I could define it, Zoe has it. She's just an amazing person. She's an amazing soul. She has the ability to connect with everybody.
Zoe treats the tiniest of babies still like a person. Zoe talks to these babies, even the 23-weekers. She talks to them and treats them like they, one, know what she's saying, and two, understand her. And I think that's something that you sometimes lose when working with really itty bitties, is that you forget that they're a child first, and you forget that they're somebody's child too. Zoe is a nurse that I would never question if she was taking care of my child. In a time where everybody is burning out, Zoe is not. Zoe does this not for the awards, not for the recognition, not for anything other than she cares about these kids and she wants to be here and she wants to make a difference, and she does every day.
The Mrs. H. Norman Bacher Jr. Nursing Graduate of the Year Award is given to a recently graduated nurse who is within his or her first 2 years of practice. The award honors Mrs. Jean Bacher, a passionate supporter of promoting lifelong learning for our nurses. The finalists are
Lisa Licata from Unit 46.
Julia Eby, Unit 35.
Benjamin Brett Goodrich, NICU.
Presenting the award is Sarah Ann Ryan.
And the winner is Lisa Licata, Unit 46.
The Evidence-Based Practice in Nursing Award is given to an individual or group who has used research-based evidence to improve patient outcomes. The finalists are
Emily Eisman, Unit 58.
Randy Morgan, Ambulatory Care Management Services.
Silvana Willoughby, GOR PACU.
Presenting the award is Jill Wheeler.
And the winner is Emily Eisman from Unit 58.
So I nominated Sharon Rossi, the Director of Perioperative Services and Endoscopy Services, for the Nightingale Award because I feel that she is a phenomenal woman. So many words I can say about Sharon. She is a great leader. She leads her team to success. She wants nothing but the best for not only the department but the institution as a whole. She holds us accountable and she expects great things, and out of that she actually groomed great leaders, which I respect because she made me who I am in the short bit of time that she's been here. I've actually grown tremendously. Her expectations is high, which I respect because she don't accept nothing but the best because she's very instrumental. You know, a lot of people have did several different projects with her and they love working with her because she executes, she get it done. Yes. She's like a workhorse. She comes in, she works weekends, she emails all weekend long, and then she'll tell me, stay off your email. You have to have a work-life balance. And I'm like, oh, well, I'm learning from the best because you're on your email. How you know I'm on mine, you know? So she wants you to have that balance in between living your life and then also working. What I will say is that she is available for any and everybody. And I don't know how she spread herself so wide and it never seems so thin. And that I don't know how to explain it, but she can spread herself, pull herself in so many different directions, but you'll never see it on her. She's never angry, never frustrated, never lash out. When you need her, she's always there. She have an open door policy. And that was amazing to me because I'm like, how do you have so much time? And she do it so gracefully though. You know, some people when they get a little bit stressed, you know, they tend to, you know, it tends to show, but with her, it just never show. She just come off so naturally and she's always supportive. She is walk through the hall, she puts on her scrubs, she put on her surge cap, she walked through them ORs, she checked them rooms, she does a lot. So like being able to see her jump into the trenches with her team members, you know, it makes you respect them even more because it's like if they willing to do what you do, then it's no, you know, like why not follow? You know, it's like follow a great leader because I want to be nothing but a phenomenal leader like Sharon Rossi. She is my Nightingale.
The Patient and Family-Centered Care Award is given to an individual who treats every patient and their family the way they would want their own loved ones to be treated. The finalists are
Jennifer Folk, PACU.
Mary Beth Hartlove, Otolaryngology. Zoe Ogden, NICU.
Presenting the award is last year's winner, Kate O'Connor Devlin.
And the winner is Mary Beth Hartlove from Otolaryngology.
The Diversity in Nursing Award is given to an individual or group who strengthens acceptance of differences through advocacy and builds on experiences different than their own. The finalists are
Kirsten Merges, NICU.
Michael Kuiper, Gilchrist.
Sylvia Algali, Unit 35.
Presenting the award is last year's winner, Mary Sebastian.
And the winner is Michael Kuiper from Gilchrist.
My name is Lacey Kidwell. I'm the manager and clinical training director of the music therapy program at Gilchrist Hospice Care. I nominated home care hospice nurse Amanda Taylor for the Nightingale Award. I think Amanda Taylor is deserving of this reward for one big reason. And that's because if I had a family member who needed hospice right this moment, she would be the nurse I would ask for. Amanda embodies the mission statement of Gilchrist, and that is to treat every patient every time as if they were your loved one. I can honestly say that Amanda goes above and beyond to make sure that every time she lays her hand on a patient, that they're pain-free, comfortable, and have the best quality of life possible. So Amanda works in our residential community care, and in addition to caring for someone at the end of life, this often brings many other challenges with it. Working with staff that are not our own, not being able to be in touch with families in a quick and speedy way, always ensuring that the patient is comfortable before she leaves to go on to her next site. So I've been a music therapist for 17 years. And so I have rubbed elbows with hundreds of medical staff. There are just some people who you know embody everything about care. Amanda has every opportunity to get overwhelmed, and you never see that. What's more is even if she is feeling overwhelmed, you would never see that in her patient care. Her patients have no idea what else is going on with Amanda other than this beautiful woman is here with this lovely smile to spend time with me, to take care of me. She's not just here to take my blood pressure or to administer medication. She's here to treat me like a real person. Amanda sees every patient not as a disease or a diagnosis or something she has to do, but she sees every patient as a human being. And I think that really sets her apart. Amanda Taylor is truly my Nightingale.
The Nurse Leader Award was established in 2018 to recognize a role model nurse who sets an inspiring example for others. The finalists are
Melissa Nichols, Center for Nursing Excellence.
Ryan McCoy, Unit 45.
Tracy Schwoyer-Morgan, Integrative and Palliative Medicine, Gilchrist.
Presenting the award is last year's winner, Roel Tiberio.
And the winner is Ryan McCoy of Unit 45.
So good afternoon, everyone. As I was reflecting on my remarks this year for the Art of Nursing celebration, I was inspired by someone's birthday today, and if she was alive today, she would have been 202 years old. And yes, I am speaking of Florence Nightingale. Florence Nightingale is widely known as the founder of modern nursing. Her story has many parallels to ours today. You know, she was a fascinating person. Not only was she a nurse, she was a statistician. Her groundbreaking research during the Crimean War was instrumental in really being the founder of hospital infection prevention. She figured out early on that if you have a clean environment, and if you put patients in a clean environment, they had a much lower mortality rate than the patients and the soldiers who were still in very dirty and unclean environments. So I think, and especially what she saw during the war and how she made patients feel, because she was known as the lady with the lamp. She used to round down these dark hallways in the hospital, and the soldiers would say, "Oh, it's the lady with the lamp who's coming to see us." And she would always be hopeful and make people feel better. And then when I reflect on what we have gone through in the last 2 years with the pandemic, and you know, that wonderful video that I want to say thank you so much to our marketing department, Matt Ellis and Tyler, who do a phenomenal job, and we're grateful for your always behind the scenes doing this wonderful work. You know, when I think about not only watching that video, what made me happy, as sad as it was, the smiles that people had and the laughter, because it came back, because we did live during very challenging, trying times where people were scared. And when nurses who pre-pandemic had to take care of an isolation patient, and you knew when you came in, you had your assignment, you maybe had 1 or 2 patients who had to be on airborne isolation, and you would wear the goggles, the mask, the hairnet. I used to give me a hair tragedy. I was a chia pet on steroids. But you knew what to expect, and you could deal with that. But when you're coming in and day out, and every one of your patients, you have to wear all of that PPE and how exhausted you are. And then to our ICU staff, who probably saw the most death than anybody, and they were the last person to hold somebody's hand. That's very hard, because you're not allowed to grieve. You have to get up. Physicians know this. You have to get up. You got to go on to the next patient. You have to have the brave face. And that creates a lot of turmoil and stress when you carry that day in and day out. So I'm grateful. The organization is grateful, because we know how hard it was for all of you to endure that. And we want to say thank you, and how grateful we are that you have stayed committed to take care of our community and each other, because it takes all of us during challenging times to take care of each other. And we made a commitment, and we took an oath, some a long time ago, some new. And I can only imagine what it's like to be a new nurse during a pandemic, going through a cyber attack. You know, back in the old days, I used to love grabbing my blue chart and saying, I know how to take an order, write an order. When that went away, you're like, oh God, there's people who don't know what that looks like. I'm looking at my friend Dr. Kaplan, who came in and helped teach some people. So we can laugh about these things now, because we are stronger together, and we have grit, passion, we're all heart, and at the end of the day, we have each other's backs, and we will always take care of our community. So thank you for everything you have done and continue to do. We are grateful, and we can't recognize you enough. So, on a happy note, I am also excited to share with you the Nurse Clinician of the Year Award.
Nurse Clinician of the Year is awarded to a nurse who lives the GBMC mission every day. He or she is an innovator who has demonstrated mastery of both clinical and interpersonal skills. The finalists are
Evelyn Kim, Safe and Domestic Violence Program.
Kate Price, Unit 47.
Kristen Feliu, Surgical ICU.
Presenting the award is last year's winner, Tracy Hickman.
And the winner is Evelyn Kim, Safe Nurse.
The Nightingale Award is new for 2022 and is the first ever Art of Nursing Award to be voted on live. It's presented to a nursing staff member whose high standards and dedication inspires others to go above and beyond. The nominees are
Zoe Ogden, NICU.
Sharon Rossi, Nursing Administration.
Amanda Taylor, Gilchrist Home Care.
Presenting the award is Dr. Joanne Iwanu.
That's the person who said my name correctly. Just saying. And the winner is Zoe Ogden. So this concludes our 2022 Art of Nursing celebration. Congratulations to all the nominees and winners. We are truly grateful for what you do, and you inspire us every day. Have a great evening, and thank you.
Great job.